A 2017 report from the Williams Institute found that 1 in every 137 teenagers, about 150,000, would identify as transgender if they were asked. And recognizing that can start with what's known in the medical community as gender dysphoria. When I spoke with Dr. Chelsea Gordner of Baystate Medical Center, I asked her to begin with a definition of that phrase.
Gender dysphoria is really when a person is uncomfortable with their birth gender. So if they're born male, they're uncomfortable being male and they potentially would identify as female.
Is there something, a particular age where we see this more commonly discussed or brought out to light?
That's a good question. You know, I see kids as young as 4 or 5, and I hear from parents and families that kids have feelings of gender dysphoria as young as 2 and 3. So it can start very young. I would say in my clinic, the patients that are coming in for evaluation are more in their teenage years, but we see all ages.
Mm-hmm. And when this conversation is coming up for parents, especially on that younger spectrum, what do you do as a parent? What do you encourage the parent to, how do you encourage the parent to approach that conversation?
Yeah, it's tough for some families. As you can imagine, it can be a big surprise for families. I would just encourage openness, talking with their child about their feelings, and just trying to leave the method of communication open so that you can see how they're feeling. Because sometimes when the gender dysphoria presents very young, sometimes it goes away as the child enters puberty, and so it may shift.
Mm-hmm. And so whether or not it shifts, you're saying parents should be open to just whatever it is their kid is feeling, validating their feelings as if you would anything that they were experiencing.
Absolutely.
So for parents who find that this is something that their children do continue with, how is that then handled or discussed?
Mm-hmm. So in the subset of children who, let's say they have gender dysphoria very young, as they start puberty and progress through puberty, some of those kids, the gender dysphoria is going to go away, and those kids don't need treatment. And in some of those kids, the gender dysphoria is going to get worse, and those are the kids that need treatment.
And so when you say treatment, do you mean psychological treatment? Do you mean physical treatment in the form of hormone therapy? What are the various treatments that you're exploring?
Mm-hmm. I think it's good at any point to consider therapy. We have a lot of therapists in the area that specialize in gender dysphoria, specifically with children, adolescents, and young adults. And so at any age, really, for a child or a young adult, it's good to start with therapy.
Talk therapy, you mean?
Talk therapy, yeah.
Mm-hmm. And so then through that process, what would be options that would be discussed in tandem with someone maybe from your office?
Mm-hmm. So some patients may want to go on to pursue medication, hormone therapy, as you mentioned.
And I imagine that would be something that's pretty controversial, potentially, whether or not that's something that a child wants to pursue.
We don't jump to treatment as our first, therapy, I guess treatment option. Counseling is really the mainstay in the beginning, but if the gender dysphoria really is persisting through puberty and worsening, untreated gender dysphoria really contributes to depression, suicide. And so we really want to support the child as best we can, and sometimes that involves medication.
Mm-hmm. And so I was looking at some statistics, and the Williams Institute at UCLA School of Law in 2017, they reported that about 150,000 teenagers in the United States, if they were asked, would identify as transgender. So how does this concept of, or does this concept of gender dysphoria link to whether or not someone's transgender?
Mm-hmm. They're very closely linked, just like you said. And so many people who are uncomfortable with their birth gender and have gender dysphoria will go on to transition and identify as transgender.
Mm-hmm. And so in terms of this idea of a tomboy or tomgirl, I think that's a concept that people long have talked about, know about. But how do you, as a parent, distinguish between the difference between maybe a child who's struggling with gender dysphoria and someone who just has an affinity for something that maybe doesn't link up with the sex they're assigned at birth?
Absolutely. So a lot of it comes down to how uncomfortable are they with their body. So you can be a tomboy, as people say, and like more masculine things, or like to play with, traditionally thought to be masculine sports or play. But it really comes down to how uncomfortable with their body parts, and do they want to change those body parts.
So when you say uncomfortable, it's not a physical discomfort, or is it a physical discomfort, or is it a mental discomfort? How are we defining that discomfort?
It's more of a mental discomfort in that they don't like their body parts. They're not comfortable with them. They're not comfortable in their own skin.
Mm-hmm. I was doing some reading online also that was profiling a young girl and her family, and she transitioned from male to female at a young age, teenage years. And one of the ways that she discovered that she felt she was transgender was by connecting with the community online, watching YouTube videos and visiting blogs and chats and things like that. With the advent of the information that's available to young people now, what has that done for this line of therapy and medical approach?
I think just like anything else, patients, children, adolescents, even parents are turning to the internet for information, and gender dysphoria is no different. And I do think it has helped a lot of people, because a lot of these patients do suffer from depression, and they may not know any other transgender individuals, and so they do find that support online. Mm. They do find information online.
And so if a child or a teenager or young adult is experiencing these thoughts or feelings, what would you say to them as they're first coming to look at these, examine these thoughts and feelings?
I would say absolutely they should be explored further and discussed further, and there are a lot of specialists in the area that can help with that, a lot of therapists that can help support both the child and the parent, which is important as well, and that would be a good first starting point.
Yeah, and then what about for the parent? I know we talked about being open to the conversation, but other recommendations that you would give to a parent?
There are some support groups in the area for parents of children who are transgender or are gender nonconforming or gender questioning, and I think that's a really good resource for parents.
Mm-hmm. And it sounds like also you're saying that it's not a hard and fast determination that's made, that there's a range of thoughts, feelings that can and maybe should be explored around this issue?
You're right. I think it's important to know that when this starts very young in life, the feelings of gender dysphoria or being uncomfortable with your body parts, those feelings may go away. And so not all children will have persistent feelings, I guess is what I want to say. But if those feelings of gender dysphoria occur after puberty and they're persisting beyond puberty, and it's really lasting more than 6 months, we really think that the feelings are probably here to stay.